Hello everyone, welcome to Aanvii Hearing. Today I'm going to talk about the role of the speech language pathologist in identifying and treating children with auditory processing disorder. Auditory processing disorder, which is APD, is a complicated disorder that impairs the brain's capacity to correctly absorb and interpret auditory information. It is especially difficult for youngsters because it can have a substantial influence on their language and learning skills. Speech language pathologists play a critical role in diagnosing and treating children with APD. In this podcast, we'll look at the important role that SLPs play in the assessment, diagnosis, and treatment of children with APD, as well as the tactics they use to help these children overcome the obstacles they confront. In addition to speech language pathologists, audiologists are integral in a multidisciplinary approach to tackle auditory processing disorder. Audiologists assess hearing abilities, contributing valuable insights for a comprehensive understanding. This collaborative effort ensures precise diagnosis and tailored treatment plans, offering holistic support for children with APD. Before delving into the role of SLPs, it's essential to understand what APD is and how it affects children. APD is a neurological condition that affects how the brain processes auditory information. It does not involve a loss of hearing, but rather the brain's ability to interpret and respond to what is heard. Children with APD may struggle with the following: auditory discrimination, difficulty distinguishing between similar sounds such as bat and pat; auditory memory, challenges in remembering and following multi-step directions or recalling information heard in a conversation; auditory figure ground, difficulty hearing in noisy or crowded environments which can lead to distractions; auditory sequencing, problems with understanding the order of sounds or words in a sentence; auditory cohesion, difficulty connecting pieces of information within a conversation. Now, what is the role of speech language pathologist? Speech language pathologists, SLPs, also known as speech therapists, are highly trained professionals who specialize in diagnosing and treating communication and speech disorders in individuals of all ages. When it comes to children with APD, SLPs play a crucial role in several key areas: assessment and diagnosis. SLPs are skilled in evaluating a child's auditory processing abilities. They conduct a battery of assessments to identify specific areas of deficit. The assessment often includes tests that measure the child's ability to recognize speech sounds, process auditory information, and understand language in different contexts. Differentiation. APD can be challenging to differentiate from other speech and language disorders as well as attention related issues. SLPs are trained to differentiate APD from conditions like hearing loss or attention deficit disorders. They carefully analyze the child's responses to various auditory tasks and use this information to formulate a diagnosis. Individualized treatment plans. Once a child is diagnosed with APD, the SLP creates a tailored treatment plan based on the child's specific challenges and strengths. The plan typically includes a range of therapeutic exercises and strategies to address the child's unique needs. Auditory training. SLPs utilize auditory training exercises to help children with APD improve their listening skills. These exercises may involve distinguishing between sounds, recognizing patterns, and following multi step directions. Language and communication support. In addition to addressing auditory processing challenges, SLPs help children develop language and communication skills. This include improving vocabulary, grammar, and social communication abilities. Collaboration with other professionals. SLPs often work in multidisciplinary teams, collaborating with audiologists, psychologists, educators, and other specialists to provide comprehensive care for children with APD. This collaborative approach ensures that the child's needs are met from all angles. Parent and teacher education. SLPs also educate parents and teachers on how to support children with APD. They provide strategies for creating a conducive learning environment and facilitating effective communication with the child. What are the strategies employed by SLPs? SLPs use a variety of strategies to address the challenges presented by APD in children. These strategies are tailored to the individual needs and goals of the child and may include the following. Auditory training activities. SLPs use activities and exercises that target specific auditory skills, such as identifying differences in speech sounds, recognizing patterns, and processing information in noisy environments. Environmental modifications. SLPs may recommend making environmental changes to minimize auditory distractions in the child's learning space, such as reducing background noise and using assistive listening devices when necessary. Communication strategies. SLPs work with children to develop effective communication strategies. This may involve teaching them how to ask for clarification when they don't understand, use context cues, or request repetition of information. Compensatory strategies. SLPs help children develop compensatory strategies to manage their difficulties. For example, a child may learn to take written notes during a lecture to help them remember information better. Speech and language therapy. In addition to auditory processing training, SLPs provide speech and language therapy to enhance a child's overall communication abilities, including vocabulary, grammar, and social communication. Home practice. SLPs often assign home practice exercises and activities to reinforce the skills learned during therapy sessions. Consistent practice is essential for progress. Technology and assistive devices. SLPs may recommend the use of technology and assistive devices such as FM systems or hearing aids to improve a child's auditory processing abilities. Auditory processing disorder can be a significant challenge for children, impacting their language development, academic performance, and social interactions. Speech language pathologists play a pivotal role in identifying and treating children with APD. Through their expertise in assessment, diagnosis, and tailored therapy, SLPs help children with APD develop the listening and communication skills necessary to succeed in various aspects of life. Early intervention by SLPs is key to supporting children with APD in their journey to overcome the challenges associated with this condition. With the guidance and expertise of SLPs, children can improve their auditory processing abilities, enhance their language and communication skills, and thrive in school and social settings, ensuring they have the best possible foundation for a successful future. For more information, visit our website, which is www.aanvihearing.com, or call us on 96 5839 5839.